Okay, so I'm looking at my face and I want to get the Botox done again in my forehead.
Lift up your eyebrows.
They're not super bad yet. It hasn't come back fully.
It's got a little bit of lines over there. Relax. Yeah, you can see the resting lines are starting to show
come
there.
back.
So it'll be a good preventative Botox regime where we lightly relax this area over here. So when you lift up your eyebrows, lift up, you will still look empathetic, interested in people, but not worried.
Okay, that's what I want. And I'm also, my eyes with the crow's feet, I think.
Tiny little smile for me. Yeah, tiny little crow's feet. It's really not necessary now, but it's a good preventative regime where we do a tiny little bit of Botox. We sometimes call this baby Botox, where we do little small amounts that will act as a preventative Botox, which will allow you to smile and still look smiley, but not create the crow's feet as you smile. You want to maintain your smile. We don't want to eradicate your smile so that you look fake.
And what about under? Can you do anything for these lines here?
The tiny lines just under the eyes of their smile again. Yeah, so when you smile you get that little line over there. Part of it is from, relax, is from the cheek coming up.
Okay.
And of course we don't want to stop the cheek coming up because that makes you look friendly. But, so that part we cannot change, but now smile, yes, that extra little bit of movement there, we can put a tiny 1 unit bit of Botox carefully over there, and that will help to reduce that. Let me just check and see if you're a safe candidate for it. No, you've got good snap. As long as you've got good snap, you'll be able to tolerate even the tiniest amount of Botox and you won't get any negative effects.
So if people don't have a good snap,
when you get to be quite a bit older than you are now, as in 75, which is a little bit older, then you lose that ability to snap back the eyelid. And if you then try the Botox, you will get this sort of effect for 3 months, which is not particularly pleasant, but luckily there are eye drops that can reverse it. But in young people, that is under 70, it's unlikely to happen. Just one more thing, lift up your eyebrows again. Looking at when we relax this muscle which lifts up your brow, it also changes the way your eyebrows lift. Do you like your eyebrows round, pointed, or flared?
Flared.
You like flared? Let's have a look.
What do you think?
In your case, I think flared works nicely. We can put a tiny little Botox in the corner of your eyebrow, in the muscle that pulls down, and that will help to give you a slight flare. As long
that would
as
help with the crow's feet too.
That will help less with the crow's feet, but more with the beginning of slight muscle overhang, skin overhang on the corner of the eyes. You don't really have it.
No.
We call that a Botox brow lift. You don't need the Botox brow lift, but we'll do it just to shape your eyebrows. Which means that when we do the brow, we must make sure that we keep the alignment such that we don't interfere with the slight flaring. If we pull it too far over, we will interfere with the flaring and we won't get a flared eyebrow. Good?
Good. Let's do it.
Excellent. Let's do it.